What dermatological condition is often seen with dermatomyositis? A. Periorbital heliotrope rash. B. Perioral dermatitis. C. Dermatitis herpetiformis. D. Miller rash. The answer is A. Periorbital heliotrope rash. A periorbital heliotrope rash is often seen in dermatomyositis. It is bilateral, symmetric, purpuric, and macular, and erupts over the eyelids and surrounding periorbital area. Miller rash, often called a butterfly rash, is seen in patients with systemic lupus erythematosus, SLE. Dermatitis herpetiformis is a rash on the elbows and knees generally seen with gluten allergy, celiac disease. Perioral dermatitis is an iatrogenic condition often associated with prolonged use of topical steroid creams. What condition typically presents as symmetric proximal muscle weakness in the upper and lower extremities, often without the presence of distal muscle weakness? A. Dermatomyositis. B. Myasthenia gravis. C. Guillain-Barré syndrome. D. Polymyositis. The answer is D. Polymyositis. Polymyositis is characterized by symmetric proximal muscle weakness in the upper and lower extremities, often without the presence of distal muscle weakness. The first sign is often weakness in the thighs while walking, the inability to rise from a seated position without assistance, or the inability to raise the arms above the head. Dermatomyositis generally includes a characteristic periorbital rash. Weakness is expressed in the neck, arms, and legs. Guillain-Barré syndrome is an ascending paralysis. Symptoms start in the hands and feet, then spread proximally as it progresses. Muscular weakness in myasthenia gravis is often especially expressed in muscles of the face and head, especially those that control eye and eyelid movement, facial expression, chewing, swallowing, and speaking. What condition is characterized by high bone turnover due to accelerated osteoclast and osteoblast activity? A. Osteogenesis imperfecta. B. Giant cell tumor. C. Paget's disease of bone. D. Multiple myeloma. The answer is C. Paget's disease of bone. Paget's disease of bone is a condition characterized by high bone turnover due to accelerated osteoclast and osteoblast activity. This results in increased calcification of bones, especially prominent in the skull, pelvis, femur, and tibia. Osteogenesis imperfecta is an issue with collagen formation that causes fragile bones and multiple fractures. Multiple myeloma is a malignancy of plasma calls, and giant cell tumors are rare tumors that generally originate from the epiphysis of long bones, with no effect on bone deposition. At what age will Paget's disease of the bone generally first present? A. Over 70. B. Children ages 6 to 12. C. Early adolescence. D. Over 55. The answer is D. Over 55. Paget's disease of the bone generally presents in after the age of 55, and is very rare in younger individuals. The prevalence in individuals over 55 is as high as 3%. Which of the following is a benign, bone-forming tumor characterized by a small area of neoplastic growth surrounded by an area of mature, reactive bone? A. Osteoid osteoma. B. Ewing's sarcoma. C. Osteosarcoma. D. Fibrosarcoma. The answer is A. Osteoid osteoma. Osteoid osteoma is a benign, bone-forming tumor characterized by a small area of neoplastic growth surrounded by an area of mature, reactive bone. Fibrosarcoma, osteosarcoma, and Ewing's sarcoma are all malignancies.